Good afternoon. I'd like to welcome you to the Flint Community Webinar on Coronavirus, sponsored by the Healthy Flint Research Coordinating Center. It is my delight today to be your host. My name is Yvonne Lewis, and I am serving as a co-director for the Healthy Flint Research Coordinating Center. It has been an extremely delightful privilege to work along with so many wonderful partners at the University of Michigan, Michigan State University, and our other community partners. Michigan State, located right here in Flint, but also both campuses of University of Michigan, Flint, and Ann Arbor, along with the community partners. As you can see here, the number of community partners who've joined us for these now, most of them for 33 weeks. What a milestone. Who thought when we first started this webinar in March, on March 20th, exactly 2020, that we would still be here today. But I want to certainly appreciate each one of you that are serving as panelists, and to all of our community participants, not only here locally in the state of Michigan, but some even from outside of the state of Michigan who have made it their single effort to be here with us every Friday at 12 noon for this webinar. We have some exciting things for you today. And so I often ask in another venue that if you have pencil and piece of paper, please jot some of the notes down as we're sharing it with you. You can also follow up with us later, and we'll give you the details about how to get onto our website so that you can actually see these webinars in the future. If you are joining us, if you're joining us by YouTube, we have our own YouTube channel now. If you're joining us by YouTube, we want you to remember that you can go to info@hfrcc.org and put in some questions if you have them, and we will certainly follow up with you. You can also give us a call at 810-835-2130. Again, that number is 810-835-2130 if you'd like to connect with us and get some of your questions into the webinar today. We want you to know, again, those of you that are listening and in the webinar, go to that Q&A button and put your questions in for the panel that will be happy to answer any of the questions that you bring forward today. And if we cannot get that answer today, we'll certainly make sure that we can follow up with you in the future. Just as a reminder, our intention is to bring some attention to this global pandemic that we've been talking now about for 33 weeks with a local flavor. There are some things that we can do in our community that can help us make a difference as we're thinking about what's going on a regular basis. So today, I'm delighted to have with us our representative from the city of Flint, Dr. Lawrence Reynolds, who is the Chief Health Advisor for the city of Flint, has been a faithful, I don't think he's missed more than one of these webinars, and that was just recently. So Dr. Reynolds, we certainly appreciate you, because even in your travel, you make it a point to be here to share with the Flint community and those that are listening from around Genesee County and beyond. So Dr. Reynolds, give us an update and give us those insights that you so adequately and appropriately share with us every week.
Well, thank you. As my colleague from the County Health Department will go into more detail, we should be clear. We are in not the best place for COVID-19 new cases over the past 7 days. There has been an increase. There's been an increase in the number of cases, and we really have to think about what we're doing. Now, I know some folks are geeked about it's Halloween and all the other holidays are coming, but my message to you is don't trick yourself. Treat yourself properly. And the first item is get tested. If you are living with someone who's sick, get tested. If you feel sick, get tested. If you leave the house, get tested. If you don't know what to do, get tested. And my colleague from the health department will go into more details about neighborhood sites and other places to get tested. But what I'm saying to you is get tested, because you can be an asymptomatic carrier. And as things have loosened up as to where we can go, remember, it's now younger people are testing positive. And I'm talking about under 30. People under 30 have more mobility because they must go to work, they must go to school, they must do things. So even though the risk of death is not as high, they can transmit the infection to someone else. And because they have more contacts, there's a greater impact on the community, and that includes our friends who are immunocompromised, our family members who are seniors. So I repeat myself, get tested. We are not out of the woods. Actually, we have moved backwards. Actually, the entire state has moved backwards, as well as the entire region. So I'll tell you, you can run, but you can't hide. You should get tested. And when you leave the house, you should wear a mask, social distance, avoid crowds. And there have been new orders from our public health department that are more detailed, but this is the bottom line. Number one, if you have a celebration for whatever holiday, restrict it to your household members. Do the other people electronically. If you must have an event, if you possibly can, do it outside. And I know it's cold, so if it's too cold, if it's raining, if it's snowing, then don't do it. It's not worth the risk, okay? If you go to an event and you see what's going around and you're not comfortable because people aren't wearing masks or not social distancing, back up, go home. That's the safest thing to do to protect yourself, your family, and your neighbors. And lastly, get your flu shot. And I'm sure we'll talk about that more in the broadcast. And make sure that your medications and refills are up to date. And if you're due for a physical, if you're due for a follow-up on whatever condition you have, call and get that done now. Thank you.
Thank you, Dr. Reynolds. I told you he's a chief health advisor. He's going to give us some real clear facts. And as he mentioned, we've got some other partners that are on that can help you with this. I just want to remind you, Dr. Reynolds, because you said we'd be talking about some of these things. If you have questions today, I want you to know that we have representatives from the health system. Katie Baxter is in the queue, ready to answer questions. Clarence Pierce from the Hamilton Community Health Center. Kyle McCree is even on the day from Consumers Energy, if you have questions there. State of Michigan, Sharonda Grigsby is on. Moses Bingham from the Community Foundation, the Greater Flint Health Coalition, Afton Shavers, and of course, Ms. Ella Green Moten to talk about community ethics review if you're interested in that. So if you have those questions, we're going to encourage you put those questions in the queue as we move forward. Dr. Reynolds mentioned that the holidays are coming, and we're going to ask Billy to come. Billy is our public health manager of public health, and Billy's going to give us some updates. And I just wonder, Billy, just as you're thinking about that, I heard the mayor talk a little bit about some things that were going to be available for our children during tomorrow. So maybe you can give us some updates on that as well. So help us, Billy, understand where we are from the city perspective.
So the mayor will have 5 different family-friendly events tomorrow. The first one starts at 4:30 to 5:30 at the Latinx Technology and Community Center. The address is 2101 Lewis Street. We also have an event going on at the same time from 4:30 until 6 p.m. at Bethel United Methodist Church, which is 1309 North Ballinger Highway. And then again at 4:30 to 6 at the Flint Development Center, which is 4121 Martin Luther King Avenue. And the last one begins at 5:30 to 7 p.m. at Burston Fieldhouse, which is 3300 North Saginaw Street. And this is in partnership with our state rep, Cynthia Neely, as well. So families can go there. The mayor strongly advises families not to go door to door. It's not an order, but he strongly recommends that people visit these 5 different sites for their trick-or-treating needs. So.
Okay. So Billy, we just want you to give us a little bit of update to get the let out. It's still a possibility for folks.
It absolutely is. I went to Road today to drop off this week's opt-in forms. And so you do have until November 19th to get your opt-in forms in. You can do that online at www.cityofflint.com. You can call me at 237-2044. You can come down to Flint City Hall between 9 a.m. and 1 p.m. Monday through Friday. Our address is 1101 South Saginaw Street. That is downtown Flint, across from the county jail. The front doors, just park out front. If you have any questions, feel free to call me at 810-237-2044. I can take your form down to Row if you like me to, or you can submit it online. It's up to you.
Thank you, Billy. Another big thing is happening Tuesday. We're only a few days away. We're only a few days away from one of the most important days in this year. Every day is important, but this is really a spectacular day, November 3rd.
Right. That's the day we vote. We vote for our president. We vote for our local state officials. We vote for everybody. And so you can still do your absentee ballot up until the day before. So that's November 2nd. You can still absentee vote here at Flint City Hall, 1101 South Saginaw Street. Come here, complete your ballot right in the clerk's office. You can turn it in right then and there. If you have a ballot, an absentee ballot with you, in your presence, you can drop it off at one of the drop boxes. There are many around the city. We have one outside of City Hall. The additional drop boxes are at Burston Fieldhouse, 3300 North Saginaw Street, Word of Life Ministries, 460 Atherton Road, Mintz Manor, 3820 Richfield Road, and West Court Street Church of God, 2920 West Court Street. Again, you can come down to City Hall. You can use the ballot boxes. We're here from 8 a.m. until 5 p.m. today. And then tomorrow and Sunday, 9 a.m. to 5 p.m. And then Monday, 8 a.m. to 5 p.m. And then Tuesday is 7 a.m. until 5 p.m.
Thank you. Thank you so much, Billy. And we're happy that the mayor has worked along with the clerk's office to keep the city hall open even on Saturday and Sunday to ensure that everyone who wants to vote has the opportunity to vote. This is our right, and we want to keep that. So please go to the polls and vote. Thank you so much, Billy, for all that great information. And I know there's more to come. When we talk about getting out to vote, we talk about getting out to vote safely. In the midst of Corona, there is some additional safety requirements that we want to encourage you. There's some recommendations, I should say, some recommendations from us here locally in our community, and then some recommendations we'll hear from the state of Michigan. Dr. Deborah Forholden has been speaking about this issue literally. She's not been traveling all over the world, but all over the country. They've asked her to talk about this. We're happy that she's here with us in our local community. Dr. Deborah, give us those tips that you share with others across this nation.
Great. Thanks for having me, Yvonne. We are getting the word out. I'm telling everybody to plan your vote and then vote your plan. I want to make sure that people can exercise this important constitutional right while at the same time staying safe and healthy. I'm asking you to think of PPE for voting in a new way. I'm calling it PPE plus C, prepare, plan, execute, and then have a contingency plan C. So what does preparation look like? I want you to prepare at home. Do as much as you can at home. Make sure that you're registered to vote. You can register in Michigan up till the day of. You can register even on November 3rd. You want to go to vote.org. That's a site that's run by the Transformative Justice Coalition, headed by Attorney Barbara Arnwine. It's a credible group. She's been doing voter protection for more than 3 decades. Go there, make sure nothing wonky happened and you didn't get purged from the rolls. Know the ballot. If you don't have an absentee ballot, I personally voted 2 Thursdays ago at City Hall. I was in and out total in about 10 minutes. It took about 5 minutes. I went with my ID. I got my absentee ballot, but I didn't want to wait until I got there to understand the ballot. I went online. You can see a copy of the sample ballot or ask a friend who has their absentee ballot. A lot of the long lines that we see outside are because people, once they get inside, where we're trying to limit the number of people, they just aren't ready. They don't realize there's more than the presidential election on that ballot, and there's a lot in Flint and Genesee County. So know the ballot. get your day of supplies, whatever you think you need. They just opened up early voting in Maryland, and all these people tried to go, and it was raining cats and dogs, and they didn't have their umbrellas. They weren't dressed for the weather. So make sure you got all your day of supplies. Get that prepared at home. Make sure on the day of you manage your personal needs. Don't go hungry. Don't go thirsty. Similarly, don't go with a big full belly or having just drank 3 or 4 bottles of water. Be prepared to be there and wait if you have to. And then make sure you wash your hands before you go. And include in your day of supplies your PPE. Okay, so you got the plan. Now it's time to execute. Executing your voting plan. The first thing, I'm sorry, go back. I went too far. Sorry about that, Tay. You got a plan. Pick the day and time that you're going to vote. I want everybody to vote early. Why? Because I tell people if November 3rd is your plan, you really don't have a plan. That should be the absolute bottom line, drop dead. If everything else goes wrong, you vote on November 3rd. We need record turnout in the early voting and day of voting. Pick your method. It's too late now. Do not put your ballot in the mail. We cannot ensure that it will get there and get counted. So when you pick a method, now you're either doing in person or you're dropping it at a ballot box. Know those locations. Let's say you get to a city hall or one of the in-person voting locations and the line is just too long and you don't have the time. Know where the ballot boxes are so you can drop that absentee ballot in the ballot box. Have a plan A and have a plan B. Again, if you plan to go in person and it's too busy, put it in a ballot box and do not mail it. Okay, so now it's time to execute. Let's say you get there and something seems off. You know, we don't have these laws in Michigan. People are allowed to troll around the voting places with firearms and other things. All kinds of weird, wonky voter intimidation things are happening. So I want people to go, take other voters with you only. This is not the time to bring your children and all of that. I love bringing my kids with me, but I bring them this time because guess what? They're now all 18. This is my daughter's first election. She voted in the primary and she's about to vote in the general. The problem is if you take non-voters, you run the risk of having excess people there, potentially contributing to spread. So this is the time to be enthusiastic and mindfully enthusiastic. Bring your cell phone, bring your sticker home, take a video as you're coming in or going out. There are all kinds of creative ways to include people and keep that enthusiasm high. And when I say mindful enthusiasm, also remember we're dealing with a virus that's spreading the air. Yelling and screaming and pulling your mask down, bad idea. Be mindful with your enthusiasm, but do be enthusiastic. And if anything goes wrong and you need to pivot, go to that plan B. It's too long or something is off or something doesn't feel right. What I don't want people to do is not to vote. When in doubt, I'm saying get out. You don't have to leave the poll, but get yourself out of harm's way. This is not the time to be confronted or to confront others about differing political views and all of that. I do not encourage people to leave the site unless they are in grave fear for their lives or their safety. If anything is off, again, Transformative Justice Coalition has set up a 1-866 number. It's manned by many, many attorneys, plenty of whom are also in Michigan and operating in Flint. One of the attorneys that's working for them is the president of the National Bar Association, Attorney C.K. Hoffer. She's one of the lead attorneys on the opioid litigation between Flint and Big Pharma. So we've got trusted, credible attorneys at the ready to make sure if anything goes wrong that we'll have good recourse. And then again, go with a plan C if anything goes wrong, but do not under any circumstances mail that ballot. Day of, make sure you take with you your ballot. In Genesee County, you can use a blue or black pen. Bring your own pen. Why? 1, you know it works. 2, it's impossible to sanitize every single pen after every single person uses it. You just avoid potential cross-contamination. Bring your cell phone. That'll allow you to engage with others and also report if anything goes wrong. Bring just one snack. Even if you had to wait several hours, you can make it on one little granola bar, banana, something like that. Bring 1 bottle of water, again, just in case. You know, people can go a whole week without water. Surely you can go a few hours. So just bring 1 bottle of water. This is not the time to have everything in the kitchen sink. Make sure you have your PPE. You've washed your hands before you left the house. You got your mask, you're masked up. You got your hand sanitizer. There's hand sanitizer at City Hall also for people who vote there. And there's hand sanitizer at the other places. but I like to bring my own. I keep a little one that's clipped onto my little carry bag. It's right here. It's small. It's at minimum 60% alcohol. Bring that. And if you have any concerns about mobility and worry about a wait outside, consider bringing a fold-up chair. You'll know when you get there if you need it. If you don't, great, go in. There's chairs inside. So plan your vote, vote your plan, vote early, and vote love, vote from your heart. I've been doing a lot of stuff on social media. If anybody wants to check anything out, you can go to @Dr.Deb4Holden on Facebook and Twitter. I did this very talk in a 5-minute video that's up on the Rainbow Push Coalition website. I'm going to put that up on my social media when we're done if you want to share this with others. Last thing, remember, check your status, plan and prepare in advance, vote early, and then stand for and support at least 3 other people in voting. Thank you so much, Yvonne.
Thank you, Dr. Deborah. And I know people are saying, why are they repeating this? That's like the commercials. We want you to know what you need to know, take the information, and please be sure that you're sharing this information with someone else. Some more on voting. Gary Jones is with us today from the governor's office, and there's some encouragement that's even coming from the governor's office. Gary, so glad to have you with us today.
Thanks, Yvonne, and good afternoon, everyone. So total confirmed cases for COVID-19 are now at 171,220. Total confirmed COVID-19 deaths are 7,298, and total recovered COVID-19 cases as of October 23rd are 114,939. And as a reminder, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, the governor highlighted programs that weatherizes homes in order to save money for low-income Michigan families. And so the governor is raising awareness on National Weatherization Day for a weatherization program that reduces household energy costs by an average of $283 per year, benefiting approximately 1,300 low-income Michigan families. The U.S. Department of Energy Weatherization Assistance Program is administered at the state level by MDHHS, the Bureau of Community Action and Economic Opportunity. MDHHS utilizes community action agencies and nonprofit organizations to provide weatherization services at the local level. Also, the 2021 health insurance marketplace rates are now available for preview. Open enrollment begins November 1st, but Michiganders can now preview the health insurance plans and rates that will be available during the upcoming health insurance marketplace open enrollment period by visiting healthcare.gov. Open enrollment runs November 1st to December 15th, but effective immediately, consumers can browse plans and see estimated premium tax credit or other savings on health insurance without logging in, creating an account, or filling out the application officially. Also, the governor and Laura reminds Michiganders to check their carbon monoxide detectors as cold weather hits. As the temperatures continue to drop and Michigan prepares to turn back the clocks on November 1st for daylight savings time, Michiganders are urged to take action to prevent carbon monoxide poisoning. Annually, about 140 people are hospitalized for carbon monoxide poisoning in Michigan and across the United States. Thousands are poisoned and at least 430 people die from accidental carbon monoxide poisoning. These hospitalizations for carbon monoxide poisoning are preventable when people are prepared. And lastly, Michigan leaders, Governor Gretchen Whitmer, Lieutenant Governor Garland Gilchrist, Secretary of State Jocelyn Benson, and Attorney General Dana Nessel, the 4 highest elected officials in the state, held a joint press conference recently to encourage citizens to make a plan to vote as soon as possible and assure them that all ballots will be counted. With less than a week until Election Day, voters should not rely on the United States Postal Service, as Dr. Verhoeven just recently mentioned, to deliver their absentee ballots, and should instead go in person to their clerk's office or a ballot drop box, as Billy Mitchell just mentioned, in their jurisdiction. Voters can find their clerk office and drop box locations at michigan.gov/vote. They can also track their absentee ballot at the same site to ensure it is received. All absentee ballots must be received by 8 p.m. on Election Day, November 3rd, in an envelope with a signature that matches the voter's signature on file with the clerk. And as always, a reminder to everyone, michigan.gov/coronavirus is still the best website to keep up with all updates.
Thank you. Thank you, Gary. It's so nice to know that there's so much information you share. So I really want people that are able to get your emails and email you so they can get this information specifically, especially as it relates to some of the other issues with our carbon monoxide as well as the energy. And again, Kyle McCree is on if you have some questions about energy. But I also want to indicate to you, to our listeners, please put those questions in now. In addition to the individuals I mentioned earlier, we also have Ian Robinson from the NRDC, the National Resource Defense Council, talked about the mapping program for the pipe replacement. He's on to answer questions. Dr. Susan Wolford, who is, I call her a resident pediatrician for the HFRCC, is available from U of M to answer questions. And we also have Dr. Rick Sadler, who's our map man, who can answer questions for you in the queue as well. So please, I encourage you to put some questions in. Now, as we're thinking about this whole issue, we heard from the state, it is so important for us to hear from our local government officials, and I say that in terms of our Genesee County Health Department. At the Health Department, they are working on our behalf to make sure that we get adequate information and some good tips. Suzanne Kupel has been with us again every week, and she's going to share these tips with us today, insights for us to know about as it relates to Flint and Genesee County. Good morning, afternoon, Suzanne.
So hi, everyone. Dr. Reynolds kind of gave you a preview of some of the things that I'm going to talk about, but we are at 5,982 positive COVID-19 test results. A reminder, this is not reflective of all the cases that have likely been in our community because we did have limited testing at the beginning of the pandemic. We have 310 deaths in Genesee County, and we currently have a positivity rate of 7.4%. Our numbers are not going in the right direction. We are entering in cold and flu season. We're entering into the holiday season. If we want to keep the economy open, if we want to keep things moving, we absolutely have to practice wearing a mask, social distancing, washing our hands frequently, using hand sanitizers with at least 60% alcohol or more, and doing all the things that we've shared with all of you for weeks now. The other thing that is so critical is that we are entering into a holiday season. We do have Halloween tomorrow. I encourage you to check out our website, www.gchd.us, for some alternative safe activities that you and your family can engage in for Halloween. I'll also encourage you to take a look at our website. There's guidance on how to plan for a safe holiday season. So this is the time to talk with your family and friends about Thanksgiving and Christmas and New Year's and Kwanzaa and Hanukkah and any other holiday that you might wish to celebrate. Have the plan and utilize that plan so that you can all stay safe. We talk regularly about what we do when someone tests positive for COVID-19. And part of the work that the health department does is connect with that individual who's tested positive. We do a thorough case investigation. We have a conversation with them about their health and health needs, and we provide education and guidance for the individual. But we also ask for who they would have been around during the time they were contagious. And our staff do reach out to connect with those individuals. And it's critically important that you answer the call and that you answer the questions that are asked of you, but also to follow the guidance that's shared with you. That is how we break the mode of transmission for COVID-19. That is eliminating that domino effect of passing the virus on to others. Now, a new requirement that has just been issued in October is to remind everyone that you are going to be required to provide your name and your phone number to those group settings that you might participate in, be it going to the barber shop or if you go to an exercise facility. any of those types of group settings, so that it makes it a lot easier for individuals to contact trace if we identify someone who's positive for COVID-19 in those settings, so that we can communicate, share information, and again, interrupt that cycle and spread. So it's not a domino effect. We're intervening to prevent the virus from being spread to others. I always remind everyone that it's critically important to take care of your own mental and physical health and to get tested for COVID-19. And one test may not be enough for everyone who's out there. Recognize that we have people who are going to work on a regular basis, and that having periodic testing for COVID-19 is important. And a reminder that about 40% of individuals do not have symptoms from COVID-19, but can pass the virus on to others. So we are very fortunate in Genesee County to have a wide variety of locations for testing, including 3 community testing locations at Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church. We remind everyone that these testing locations use a oral swab, and that you are to stop using food, drink, tobacco products, chewing gum, anything like that that could interfere with the test 30 minutes before you go for testing. There are appointments that are encouraged, but every one of these sites is available. If you just walk in and need a test, they will accommodate you. All of them have been site visited for ADA access. If you have English as a second language, deaf of hard of hearing, or any other person that has an issue with any form of language or disability, they will accommodate you. So there is no reason you can't get tested at any of these locations. And again, we encourage you to do so. We're also fortunate to have some pharmacy locations. There's a new site at Walgreens on Davison Road in Flint, and we have the Rite Aid in Swartz Creek and the Rite Aid in Flint that are available for testing by appointment, and they are doing nasal swabs or nasal pharyngeal swabs. The pharmacies are doing the nasal swab. Hamilton's doing nasal swabs and nasal pharyngeal swabs. That is the North Point Clinic and the fire station in Burton at the corner of Bristol and South Saginaw. And again, Hamilton is doing theirs by appointment as well. Just a reminder to everyone, the health department is open for business at both McCree South and at our Burton location. We are doing our Burton clinic services by appointment. That's WIC, family planning, immunizations, and sexually transmitted infection testing. All of those are available to you. Again, this is the time to get a flu shot. If you haven't already gotten one, please do so. We are having 2 respiratory illnesses in the same time frame, both influenza and COVID-19. We want to keep everyone healthy so that we can keep the emergency rooms free to assist those that have emergent health conditions, as well as those that have COVID-19. So we don't want to overwhelm our healthcare system. I always encourage you to mind your own personal health and mental health. That includes making sure you're eating well, exercising, that you are also being mindful about all of the things you watch on television. Don't overwhelm yourself. Again, we have plenty of great mental health staff available in our community to assist you. And we also encourage you to make sure you are following up on all of your regular health screenings and regular doctor's visits. That's really important that we're all taking care of one another as we get through this winter season. So again, plan ahead for the holidays, make a plan with your friends and family, stick to that plan, wear your mask, and do all those preventive measures.
Thank you, Suzanne. We are doing a lot of planning here today, and we hope that you're taking notes. I'm excited that in our community, we have so many access points. And so appreciate appreciation goes out to a number of people who have worked diligently behind the scenes at the local and state level to ensure we have these testing sites. So those of you that are resources for others in the community that are not listening today because of there are reasons that they cannot, we are asking you to continue to be advocates to get this information out. It is on other websites, but you can certainly find it on our website as well. Another important thing that's happening right now, as Suzanne was mentioning, these two viruses that are going on, people are in need of healthcare coverage. And we know that right now, open enrollment for Medicare is available, but then soon the open enrollment for the Affordable Care Act in the marketplace. Jim Melanowski, who is the CEO of the Genesee Health Plan, is here today to talk to us about what's going on, particularly as it relates to the Genesee Health Plan. However, what is going on with these overall opportunities for our community? Welcome, Jim.
Well, happy Friday, Yvonne.
Thank you.
I love this weekend because we get that extra, Gary Jones mentioned it, we get that extra hour of sleep. So, you know, we've been all going through a lot with COVID-19, so let's all treat ourselves for that extra hour of sleep. Don't forget to set those clocks back. And he also mentioned make sure you check your smoke alarms and your carbon monoxide detectors, make sure those are working as well. It's a good time to do that. Yes, so it's a good time to do that, and it's the yearly time where there are these open enrollments into healthcare. So I want to go over that with everybody. I am from the Genesee Health Plan, and we provide basic healthcare coverage and services to Genesee County seniors, residents, adults, and families. Over 90,000 Genesee County residents have been on Genesee Health Plan coverage at one time or another. So if you think about it, it's pretty amazing that over the last 19 years, we've assisted so many. And now we're assisting over about 10,000 people each year, either getting them on Genesee Health Plan or getting them on other coverages or other services that they might be eligible for. There's always open enrollment in Genesee Health Plan. So, you know, you don't have to wait for a certain period of time or a time period in the year to do that. So we provide basic healthcare coverage for Flint and Genesee County residents, and it's funded by the Healthcare Services Millage. We're very fortunate in our community when there's talk at the national level about eliminating the Affordable Care Act, Obamacare. We at least have a safety net here in Genesee County. And especially for those people who, like during this COVID time, have lost a job, or maybe are working 2 or 3 jobs that do not offer healthcare coverage. Those are the people that should be contacting us, and we can get them on Genesee Health Plan. So it's basic coverage. It's not insurance, but we pay for doctor's visits, prescription drugs, cancer screenings and mammograms, those preventative services, outpatient mental health services, services that Genesee Health Systems aren't able to provide to everyone, senior veterans dental programs, so dental care, labs, and x-rays. So all those things are covered by the coverage that Genesee Health Plan offers. And again, there's not any, it's a continuous enrollment into that. So if you lose your job tomorrow, come in on Monday, call us or come in, and we can assist you and get you at least some coverage on Genesee Health Plan. It also is continuous enrollment into what we call the Healthy Michigan Plan. That is the Medicaid expansion that came with the Affordable Care Act, and that is through the state of Michigan, but our staff is able to assist people in enrolling into that. And I would be remiss also to not mention that there are other partners in the community that do the enrollment as well. So our friends at Hamilton Community Health Network are able to do enrollment into healthcare. At the health department, they're able to do that. At the Greater Flint Health Coalition, they have staff that are trained to get people enrolled into these different programs. So I'm talking from the perspective of the health plan, but don't forget that there are so many touch points in the community where people can go and get health care. So Healthy Michigan continuous enrollment, as well as just in Medicaid in general. Gary Jones mentioned, and you mentioned, Yvonne, Medicare open enrollment period. So and I'll talk more specifically about that. That period is open now. So we'll talk about that in just a minute in more detail. My Child and Healthy Kids is continuous enrollment. There should not be one Genesee County child that does not have health insurance. So if you don't remember anything else that I say, and most people don't, please, if there's any children out there, there is coverage for them. So it's called My Child and Healthy Kids, and we and these other agencies can assist families in getting that coverage for their children. And yes, it is open enrollment time starting on November 1st. So starting on Monday with the what we call the Health Insurance Marketplace, the Affordable Care Act, Obamacare, whatever you want to call it. That period starts November 1st. We're going to talk a little bit more about that in detail. And then through the efforts of a lot of people, we were able to get some special coverage for those people that were impacted by the Flint water crisis. And it's a special Medicaid type of coverage that's not only for Flint residents, but anybody who did business or went to school in Flint, that's available as well. And so our staff, and again, the other staff from these other organizations can help people enroll into that. So don't forget about that. We want to make sure that we can get people enrolled. This is the eligibility criteria for people for getting, and it's pretty simple, for getting GHP type of coverage. Must live in Genesee County, are at least 19 years of age or older, have no health insurance, meet income requirements, and you may have Medicaid spend down and still be eligible to enroll. So just, again, it's pretty broad. We used to have a cap. It used to be 64, but we have found that there are seniors in our community who do not qualify for Medicare. They work in a faith-based organization like a church. They might have come to our country later in life and have not paid into Medicare like we all do on our checks. So it's important to just educate people on the fact that anybody can be on that. Medicare open enrollment. So Medicare open enrollment began October 15th and ends December 7th. So we're about 2 weeks into it. It's not for Plan A and Plan B of Medicare, because that automatically is given to somebody, but this is for the Medicare supplemental plans and Plan D, which is a prescription coverage. So there's a number of ways that people can be assisted in this, but if people can get on Medicare.gov, they can do this themselves and then re-enroll into these plans. If they put in the prescriptions that they have with their dosage amounts and their Medicare number, they can see what they qualify for, and it gives them the different plans and what those payments, those additional supplemental plans will cost. I have not done that. Our enrollment staff does it all the time, and they say it's pretty easy to navigate. So I would encourage people, if that might be a starting point. Dr. Verholden talks about doing your homework and planning ahead. Go ahead and look at Medicare.gov and see what options are available. And then either call us for assistance, or if you feel comfortable going through that website to apply for those Medicare supplemental programs or Plan D, great. So remember, you need your prescription drugs. You want to get a plan that's going to help cover the drugs and medications that you're on. It does not do you any good to get the cheapest plan out there if it doesn't cover the things that you need. So again, do your homework, look at those things. And then make sure you have your Medicare card with you. Starting November 1st, it's enrollment into Obamacare or healthcare.com. And that open enrollment period is November 1st through December 15th. And coverage can begin as early as January 1. This includes re-enrollment. So most plans, if you've already been on one of these, will just roll over and you'll be able to automatically but you might want to make some changes. You want to, there are certain things that you want covered this year, or you have new medications that you're on. So now's the time to do your homework. You have a few days this weekend, or you can get on that healthcare.gov and enroll into these programs starting November 1st. But a bit similar to what I talked to you about on Medicare.gov are all the options and all the different plans that are available to you. And so now's the time to start doing that. If you do not, I'm sorry, if you could go back to that other slide, just so yes, so even if, and the only time that it's open otherwise for open enrollment into this is if you have a special circumstance that would require a special enrollment period. And that's what people sometimes forget. They think they have to just do this on an annual basis. But if there's a certain status change, like they got divorced, got married, lost their job, whatever difference could happen to them, they can go on anytime and enroll into Obamacare or the healthcare marketplace. So, but again, call us if you need that assistance. Next slide. So again, I've encouraged people, they can go on these healthcare.gov, medicare.gov, and do all this research themselves. But really, sometimes it's all very confusing. And healthcare, we've talked about that over and over. Sometimes it's not really easy to navigate. And so that's why we have staff and these other agencies like Hamilton and the health department and the Greater Flint Health Coalition have staff that are trained. They're certified in all of these areas to help somebody. So they can go to our website for more information. They can call that number, 810-232-7740, to speak to an enrollment specialist. And very important, you'll see signs along the road at the corner, call for open enrollment, or you get those junk mail texts or messages. Those are scams. You don't want to pay anybody to help you enroll into healthcare. There is absolutely no need for that. So if someone wants you to pay to help them get into Medicare or any of these other things, don't do it. So just give us a call, give one of those other agencies a call, and we can help you get enrolled in whatever healthcare that you qualify for. And I think
Thank you. Yeah.
Yep.
Thank you so much, Jim. And if there's some questions, I certainly want to share, re-emphasize, I would say, that you mentioned that no one really has to go alone on this. It can get to be confusing, and many people have just decided they weren't going to follow the process. So we're encouraging you, please call. You don't have to do this alone. We have a number of community health workers across these organizations that you mentioned, Jim, that can help our community. So please, we want to encourage you. You don't have to go this alone. The other thing I wanted to emphasize is that these organizations are partnering. I like the way, as we've seen through this webinar today, across our community, organizations are partnering together. They have their special niche, but there are some things that we do collectively to ensure that our community has what it needs. And so, Tay, I want to skip a couple of slides. I want you to go to that next slide, because here's an opportunity. Dr. Verholden mentioned it. Suzanne mentioned it. Flu season is upon us. Fortunately for us right now, we don't have any cases of flu, but I want to ask Clarence Pierce to mute himself, because Hamilton has a list of opportunities for flu vaccines, as well as some working along with the COVID vaccines. And so all of the partners that have some work in this area, we want you to be prepared to chime in. Clarence, can you give us, this flyer is available, it is on your website, but would you just review this for a moment with us, please?
Yes, Yvonne, happy to be with you once again and getting this information out to members of the community. Hamilton has a flu vaccine clinic. We do a curbside clinic from 10 a.m. to 3 p.m. No appointment is necessary. And on Mondays, we actually have those clinics at Main at 2900 North Saginaw Street. And on Wednesdays, we are out at Clio. And Fridays, we're at Lapeer. Now, we're also doing evening hours, Yvonne, from 5 to 7 p.m. so that we can have people who may be working and unable to get to the clinics during the day. And no appointment is needed for those clinics. And we were there October the 21st at Maine. We will be at Burton on October 28th and November 4th back at Maine. The 11th of November will be in Lapeer, and on November 18 in Clio. December 2nd, we are at North Point, and December 9th, we're at Lapeer once again, and December 16th at Clio, and on December 23rd, North Point, and the 30th at Burton. Now, we are also doing clinic at the actual site. These are more of a drive-through and get your shots, but the clinics will also assist with giving shots. And the drive-through clinic on Tuesdays and Thursdays, of course, that is where we also do the COVID testing as well. And that is from 9 to 4 p.m. at the North Point Clinic, right there in the North Point parking lot, and at the Burton Fire Station #1, right there at South Saginaw and Bristol. And just call that 810-406-4246 number to schedule an appointment. And that way you just pull in, get your shot, and pull out. And on Mondays through Fridays, of course, during regular business hours, as I mentioned, you can also visit any of our clinics, and we can provide you with the flu shot or the COVID test. An appointment is required, so please feel free to call that number and get in and get your flu shot, so that if we have any kind of COVID wave coming through, at least you have done the minimum to protect yourself. So, and it is free. So please stop in and get your shots as soon as possible. Thank you, Yvonne.
Thank you, Clarence. Now, as you mentioned, there are a number of opportunities throughout the month of November. As I was reviewing today, Dr. Reynolds brought this forward as an important issue to get the flu vaccine. Suzanne Cooper brought it forward, and again, Jim's bringing it forward. There are a couple of other activities that are going to be coming up in November, and I'm going to ask Dr. Reynolds, you said something in a conversation that was earlier today that I want you to emphasize, but I want to let our listeners know that through the Genesee County Influenza Immunization Education Partnership, which is a partnership with Health Alliance Plan, Genesee Health Plan, Hurley Medical Center, the Health Department, Hamilton Community Health Network, we're working on an ongoing basis to try to make sure that immunizations, not only the flu, but other immunizations are available to our community. So another date you can mark on your calendar, a flyer will be coming forward, is November 19th at Shea Automotive. Hurley's key event, signature event for the year will be there, and they're going to be giving out turkey. So it's a little bit, we got a couple weeks, but we'll remind you about that one. And then the Genesee Health Plan has partnered and been a part of the National Influenza Vaccination Week. That's the first week in December. And on December 11th, we're again partnering with the Blue Cross Blue Shield and other partners, a free medical clinic, to bring more flu vaccines. So there's absolutely no reason that folks cannot get a flu vaccine if needed. Now, Dr. Reynolds, you mentioned something in an earlier call for seniors, and I want you to just come back and talk a little bit about that. You and I are both in that senior category, and we recognize that the high dose vaccine is available. Can you speak to seniors thinking about getting their vaccine if the high dose may not be available for them?
Oh, yes. It's a simple choice. If the high dose vaccine for seniors is not available, get what is available. That's most important. We cannot go without protection. And I'm speaking as a pediatrician who is also a senior. Get vaccinated, get whatever is available, be it the high dose for seniors, but do not turn around and walk away if they say, we have the other vaccine. Please get it. We cannot risk having 2 infections at one time.
Thank you, Dr. Reynolds. Just want to make sure that we understand that it is still effective, even if it isn't the high dose. Thank you so much. I want to invite Dr. Deborah for holding back for a quick moment here before we close out today, because we did have a little bit of conversation. Billy mentioned to us some safe places that the mayor has put in place for our children for tomorrow. But Dr. Deborah Verholden had some tips she wanted to provide for us about a safe Halloween.
So the mayor decided not to mandate that people can't go door to door, but we're recommending that people not go door to door. Why? Because we don't want people spreading coronavirus. We don't want kids picking it up, nor do we want them spreading it to our neighbors. So I'm just going to direct everybody to the chat. I'll quickly call it off for people who are on by phone. There are 5 sites that the mayor has set up for safe, COVID-friendly candy giveaway trick-or-treating. It's going to be noon at Sarvis Park at 4000 Wisner Street, 4:30 to 5:30 at the Latinx Technology and Community Center at 2101 Lewis Street, 4:30 to 6 at Bethel United Methodist Church at 1309 North Ballinger, 4:30 to 6 at Flint Development Center, 4121 MLK Avenue, and 5:30 to 7:30 at Burston Fieldhouse at 3300 North Saginaw. That's going to be done in partnership with State Representative Cynthia Neely and the County Commissioner Bryant Nolden. That Rock Apparel is also hosting a drive-through or walk-through candy giveaway at the Capitol Theater. Many other vendors are participating in that. That's from 4:30 to 7, and little Miss Flint will be there to encourage her peers. And then there are all kinds of other events that local churches are hosting that have additional safety protocols to let our babies enjoy this really fun time, but also to stay safe. There's an announcement that the mayor put out. I think if you go to the City of Flint Facebook page, you also can get that information. And all these events are going to be happening on Saturday, Halloween Day. And again, everybody just stay safe.
Thank you, Dr. Deborah. Quick response to a question that was in the queue. The vaccines, the flu vaccines at these various locations, there's no out-of-pocket cost. Of course, if you have insurance that covers it, they may ask you for your insurance card, but there's no out-of-pocket cost. Did you have something else you want to add to that, Dr. Reynolds?
Yes. If you ever have any question about what the cost will be for you, ask the pharmacist at that location, because sometimes not all the chains work with your plan. If you can't get an answer, check with your plan and tell them where you live and ask them what are the drugstores that are available. As I may have spoken about in some earlier episodes, my brother had to find out the hard way. He went for his Shingrix and they said, that'll cost you $287. And I advised him to call his plan. And then lastly, if you have no coverage, I'm sure Genesee Health Plan and the manufacturer of the vaccine can assist you in connecting to where you can get a vaccine or sometimes other medications at reduced price.
Thank you.
The health
Dr.
insurance system
Reynolds.
is complicated.
Thank you, Dr. Reynolds. That's a whole nother webinar. We're gonna have to work on that. As we're preparing for our closing today, we appreciate all of you that have been on. Dr. Deborah, there's an event that's coming up on November 20th. We just want to highlight right quickly. Can you give us some quick insights for the annual symposium of the Healthy Flint Research Coordinating Center?
Yeah, we had to move it to online. It's normally in person. It was in March. We had to reschedule it. It is happening November 20th. You can register at hfrcc.org. The thing I want to point out for this group is we have 5 awards that we're giving away. The awards are beautiful, big, beautiful. I think they're prettier than Emmys. Big, beautiful glass awards. They're really heavy, really pretty, the kind of thing people will be really proud to get. Again, go to hfrcc.org and make those nominations. They're due by 5 p.m. next Thursday, November 7th. We've got plenty of awards for community partners, for academic partners, for community academic collaborations. This year, Mayor Neely and Chancellor Dutta from U of M Flint are going to be given the opening address. The James Jackson Memorial keynote is going to be given by Marjorie Innocent. And our very own Charlie Nelms will be here to close us out. Rick Sadler is going to give us some final comments on it. It's going to be a magical day from 9 to noon, and it'll also be the launch of our first research symposium. It's going to happen once a month, immediately following this.
Thank you,
More
Dr.
on that
Deborah.
next week.
Yeah, more on that, because immediately following this, your comments will be their closing for today. We want to thank you all for tuning in today, joining us for this webinar. Please continue to look us up and like us on our Facebook, join us on our YouTube channel, or subscribe by going to Healthy Flint, and like us, look at our YouTube channel even following this. That 1 minute evaluation is going to pop up for you. We want you to complete that for us because it does help us. And we'd like to invite you to join us next week for our 35th or 34th webinar. Our 34th webinar. We'll look to see you next week. And thank you so much for joining us today.